Welcome to our third and final community awareness event of the year. My name is Abby Edgecombe, SCIP coordinator for Lincoln Lancaster County. SCIP stands for School Community Intervention and Prevention, so we work with our schools to help support student mental and behavioral health all over Nebraska. But I serve the Lincoln Lancaster County area, and we're grateful to have Lindsay Brundege here tonight. She is with Jenda Family Services. We've talked about nicotine and addiction and some of the THC vaping that we've seen in some of our previous community awareness events. Lindsay's going to kind of tie all of it together, especially with some of the mental health pieces that we're seeing and some of the reason behind some of the use that we're seeing in our kids with both vaping of THC and nicotine. So she's got some great slides and information to share with us. If you have questions along the way, please feel free to interact and have conversation. I'm sure she would appreciate that as well.
As Abby said, I'm Lindsay Brundege. I am with Jenda Family Services. I've been a therapist for since 2014. I will be talking about teens and vaping tonight, not just nicotine, but marijuana, because we're starting to see a lot more of that amongst teens lately, especially since hemp, I had to think of the word. Hemp has become legal federally. We're starting to see a lot of the Delta 8 products being used. And in Nebraska, and I don't know about other states, it's not very regulated. So we don't know if there are high amounts of THC. It's supposed to be less than 0.03%, but there may be more. We don't know where people are getting it, those kinds of things. So anyway, we'll get started. I may ask you some questions. If you don't have the answer, that's okay. Just to kind of engage you a little bit. All right, so why do teens vape? Well, friends and family members use them often. I have a lot of teens that I see that say, oh, I get it from my brother, or I have friends at school, we get them all the time. They come in many flavors: bubblegum, cherry, strawberry, some mixed flavors that I've never even heard of. They're like, oh, this is the dragonfly berry smoothie one. Okay. There's a belief that vaping is not as harmful as smoking cigarettes. I have seen that in a lot of places. I've had a lot of kids telling me, oh, it's not as bad because it's vapors. It's not the nicotine and the tar and everything that are in cigarettes. Well, but do you know what's in the vapes? So that's part of the issue. There's a lot of chemicals that they're finding are probably a little bit more harmful than originally believed. Vapes seem to be easier to access than other tobacco products. I have a teen client right now who told me recently he's able to go and get his vapes at the smoke shops here in town. He's got a couple people that will sell to him. You have to be 21. They don't care. There's ease of access. They try to say that they do not advertise towards kids. Yes, they do, pretty heavily. They cost less than other tobacco products at times. Easier to use indoors where cigarettes are not allowed because they have minimal smell or it evaporates quickly. Or if you walk in your kid's room and it smells a little fruity, that may be because they just used a vape. They may use them to stop using cigarettes or other tobacco products. Marijuana can also be vaped with little to no smell. They may be using because they're bored. I've had kids tell me that. I'm just bored, nothing else to do. My friends do it. Other reasons you've heard. Curiosity, yep. That's a big one. Any others? I hear anxiety a lot. The fact of the matter is they're really uneducated when it comes to, specifically marijuana. THC levels increase anxiety as the levels go up. So there's a lot of that as well. So addiction in the brain, why is it difficult to just stop? I'll give you a little bit here, and then I will show you in just a little bit a couple of video clips that explains it a little bit more scientifically, and one that's not as scientific so you can get a better understanding. Drugs, in particular nicotine and marijuana for the purpose of this presentation, they interfere with the way the brain sends and receives messages. Marijuana mimics the chemical structure of a neurotransmitter or chemical messengers, but they do not act in the same way and abnormal messages are transmitted. Drugs, nicotine, marijuana impact the brain's reward center causing the excess release of dopamine. That's our pleasure chemical. So other than drugs, food releases dopamine. Any activity that you find exciting, fun, will release dopamine. Due to continued drug use, the brain becomes used to the drug being there, and a person has to use more and more of the drug to feel high or feel normal, essentially. It's also difficult for someone to feel pleasure from anything else but the drug, and therefore a person may feel flat, depressed, and unmotivated. Drug use becomes survival in order to feel normal, and so the cycle of use continues. And that's pretty much with any substance. Now, there are some substances, I'll actually show you on the next slide, just because I couldn't find one for marijuana or nicotine, that produce or release or cause the release of more dopamine than others. Methamphetamine, for one, is the substance that releases the most or causes the release of the most dopamine, and that's why they say that that one's highly addictive. Just to kind of give you an idea, this is cocaine use, but this is the same thing that is happening with nicotine and marijuana as well. This here on the right, the brain, shows the dopamine pathway, so the pleasure chemicals. These brain circuits are important for natural rewards such as food, music, sex. This is showing the dopamine released while eating food. Not as much. It doesn't produce as much dopamine as a drug does. Drugs 2, 3, 4, 5 times as much as your more natural rewards. Typically, dopamine increases in response to natural rewards such as food. When cocaine is taken or any other drug, dopamine increases are exaggerated and communication is denied. So it interrupts that communication between neurotransmitters. So that kind of just gives you an idea of what is happening. In fact, too much of that can be released, and that's what gives that feeling of a lack of pleasure, because they kind of use up all their dopamine stores. So I'm going to give you some clips here. They're pretty short. The first one is about 3.5 minutes. It explains a little bit as to why it's difficult for people to stop using substances. And then the next one, 1.5 minutes, will kind of continue it a little bit. And then the last one is more of an animated video that puts it, I think, in simpler terms. I wanted to give a little bit of a brief overview. Different substances may be more or less addictive depending on the amount of dopamine that is released upon use. But essentially, all illicit substances, nicotine, are considered addictive, or somebody can develop a habit. Any questions?
But something, we hear from kids is that difficulty in stopping. And I just came across a statistic not too long ago that of kids who start using nicotine in middle school, over half have tried to quit by the time they get to high school. And so I love that video really highlights the difficulty that kids have with that, and that withdrawal, and then, that relapse, and just the importance of them needing support through that process.
Yep. And typically all substances have withdrawal too. It just looks a little bit different in each substance. Some is more severe than others. You ask kids, like, have you ever had marijuana withdrawal? They'll tell you no. And so you have to explain it. And I don't have a lot, I don't think I have anything on withdrawal, but typical withdrawal you will see with marijuana is irritability. So that's the huge one that we will see. And so I'll ask kids that, will you ever experience any irritability after you stop using marijuana or nicotine? Oh, yeah, I guess I do. And I said, well, that's technically considered withdrawal. It's not your typical, vomiting, nausea, sweating, where you might see with like alcohol withdrawal or opioid withdrawal. So, okay, so nicotine and marijuana's impact on the developing brain. So our brains are typically developing, scientists will disagree, 25 to 30 is when they say they stop developing. So there's a lot of growth going on and changes happening in the brain from ages 12 to 16. So that's a really, what's the word I'm looking for? It's a period of time where substance use is most dangerous because it can change the way the brain communicates. So let's just start with nicotine. Here I said the brain keeps developing until about the age of 25, and nicotine causes harm to the parts of the brain that control attention, learning, mood, and impulse control. Nicotine also changes the way the connections are formed in the brain. Nicotine use can lead to addiction. If youth never smoked cigarettes prior to vaping, they are at a higher risk of doing so in the future. So vaping actually has been shown to increase the risk of cigarette use, which I thought was interesting. Also, they have found youth may experience higher levels of ADHD as well, which is attention deficit hyperactivity disorder. Marijuana, short-term effects, so they're talking about like less than 24 hours, immediately impacts thinking, attention, memory, coordination, movement, and perception of time. Some stuff I pulled directly from the CDC. Using marijuana before age 18 may affect how the brain builds connections for functions like attention, memory, and learning. Marijuana's effects on attention, memory, and learning may last a long time or even be permanent. But more research is needed to fully understand these effects. Youth who use marijuana may not do as well in school and may have trouble remembering things. How marijuana impacts the developing brain also depends on how much someone is using, how often, the age of first use, and whether other drugs are being used at the same time. Heavy marijuana use may also be linked to schizophrenia. I wanted to pull up this article really quick. They're seeing this a lot more in males. I'm not sure exactly why they're seeing it in males more so. I'm not going to read the whole thing, but I just wanted to go over like the first, was it the first part? Yeah. So it says it was a Danish study that shows up to 30% of psychosis diagnoses in young men could have been prevented if these individuals had not used marijuana heavily. This may seem a little more marijuana heavy. A lot of times kids will start with nicotine, move on to marijuana, move on to heavier things. So it says this was likely the largest epidemiological investigation conducted to date that directly focused on the cannabis psychosis question from 1972 to 2021, so huge. They examined health records of 6.9 million people and found that up to 30% of schizophrenia diagnoses, about 3,000 in total, could have been prevented if men from ages 21 to 30 had not developed a cannabis use disorder. The comparable prevention percentages for the broader range of 16 to 49 were 15% for men and 4% for women. So there's a little bit that says that the study does not offer hard and fast proof of the cannabis schizophrenia connection, which could be accomplished only through randomized controlled trials. They found that the proportion of cases of schizophrenia that were attributable to cannabis use disorder and those that might have been prevented was much higher in males and females, and in particular, younger males in whom the brain is still maturing. And we saw that this increase was taking place over time, completely in parallel with the increasing potency of cannabis. And that's the huge concern right now, is the potency. I don't know if you've heard of the term dabs, wax, shatter. It's higher concentrations of THC, and sometimes we're seeing, anywhere from 80 to near 100% THC, which is then leading to emergency room visits for paranoia, vomiting, upset stomach, all sorts of stuff, high levels of anxiety, and then psychosis or schizophrenia. I think that was all I wanted to kind of point out from that article in particular. So very interesting stuff. I know there's been other studies as well. I just wanted to highlight this one because it was a pretty large study. So that's pretty scary when it comes to substance use, is when it starts to affect your mental health. All right. So getting more into mental health concerns. Despite the popular belief among youth that nicotine and marijuana use decreases their stress and anxiety, this is not true. Vaping or use of these substances can increase stress, anxiety, and depression in youth. The research is out there. Substance use in general is often associated with higher instances of mental health concerns. Many individuals with a substance use diagnosis also have a mental health diagnosis. Higher concentrations of the chemical THC in marijuana have shown increased instances of emergency room visits for panic attacks and paranoia, kind of as I had mentioned earlier. A survey study conducted by the American Heart Association found approximately 70% of the THC-only vapors and 60% of the nicotine-only vapors and dual vapors, so using nicotine and marijuana, reported experiencing anxiety symptoms such as worries, flashbacks, which can be related to trauma, panic attacks, and situational anxieties within the past week, compared to about 40% of participants who had never vaped. Over half of the nicotine-only vapors, THC-only vapors, and the dual vapors reported experiencing symptoms of depression. Over half. And this is nicotine and THC and combined. So depression, defined as difficulty engaging in or being interested in activities normally enjoyed, whether they felt that depression interfered with their ability to do the things needed to do at work, at school, or at home, and whether depression interfered with their social life and relationships within the past week, compared to 25% of non-vapers. More than 50% of people in all vaping groups reported having suicidal thoughts within the past 12 months, compared to only 1/3 of the non-users. That's pretty scary as well when we're seeing increased suicidal thoughts. So we know, yes. It actually depends on the client. Sometimes we see substance use leading to mental health concerns, and other times we see mental health leading to substance use, because a lot of times we have people who have been through traumatic experiences, may have like post-traumatic stress disorder, and they'll use substances to deal with the symptoms, to try to reduce anxiety or numb their emotions so that they don't have to feel. So it really just varies. If they have not had a history of mental health and start using substances, sometimes you see an increase of mental health symptoms in people who have never had mental health before because of the substances.
And you will see that in teenagers.
A lot of them don't know what else to do, because these substances, nicotine, marijuana specifically, are easily accessible and available. So they turn to those without really recognizing that, okay, there's other ways, healthier ways to cope. And we'll talk about that a little bit. About 1/4 of the dual vapors and nicotine-only vapors started vaping nicotine to calm down or feel less stressed. And 1/3 of participants in both groups reported that they currently vaped nicotine to cope with feelings of anxiety. So we hear that a lot. In contrast, about half of the THC-only vapors started vaping THC and currently vaped THC to relieve anxiety. And a lot of that is also coming from the media in other states that are legalizing marijuana. They're saying, oh, it's great for this, this, and that. And there's a lot of research to suggest that, especially in young people, it's actually creating kind of the opposite effect. So around 20% of nicotine-only vapors and dual vapors started vaping to help feel less depressed and currently vaped for this reason. About 1/3 of THC-only vapors started vaping THC, and nearly half currently vape THC to feel depressed. So lots of concerns.
Yeah, that mixed messages with the marijuana. I know when we are in and out talking to kids, that comes up a lot. There is that real perception that this is a safe substance to use and that it's, helping them. And in their minds, probably in the short term, they probably do feel some relief, but it feeds that addiction and it gets worse and worse.
Yeah. Well, and sometimes when we're talking to these kids that say they use for certain reasons and well, it doesn't cause any problems in my life. And so then I have to dig a little, okay, well, let's talk about that. Actually, you talk about how you have anxiety. That sounds like that might be a bit of a problem for you. Let's talk about other ways that we can better manage that without having to use a substance, because a substance is a temporary solution. So, and it can lead to more severe drugs or worse addiction. So, okay, how can parents, adults, professionals help? Talk to your kids about the harmful impacts of vaping, nicotine, and marijuana. Don't count on the schools to do that. They don't always do that. I don't know if they're doing it as much. Be aware of withdrawal symptoms for nicotine and marijuana. And there's some resources where you can look those up, what that looks like in teens. Talk to your child's doctor for assistance. A lot of times they can help. Encourage youth to talk to a trusted adult if they are struggling with mental health or addiction problems, such as a school nurse, counselor, coach at school. Seek assistance for youth's mental health concerns, and we'll talk about where and how you can do that here in Lincoln. There is also the Nebraska Tobacco Quit Line. I'm actually not too familiar on how they deal with, or if they, with youth and smoking. Does anybody know?
They do.
Okay.
13 and older.
Okay.
There is also now a text line that they have available.
Okay.
And in the LPS school system and some other schools in the area, we have mirror cleans up that have a text line to go to This Is Quitting, which is
awesome.
through the Truth Initiative.
Mm-hmm.
And so 13 and older, they can text Ghost Vape to 88709, and that will connect them immediately to This Is Quitting program. They can sign up and subscribe to it all themselves.
That's great.
And so then they don't have to, sometimes that's a barrier for kids if they have to tell an adult or if they have to get permission
Right.
to get help, then they won't do it. And
Yeah.
so that's an easy way for them to access those services.
Perfect.
And I will say we've been talking about that text to quit line. It really is a great resource. I've texted it, not because I'm a vapor, but if I'm sharing a resource, I want to know what that looks like and feels like. And they respond immediately, and they help you identify a quit plan and coping skills and all these, resources that kids really need. And as we talk to schools about it, kids, most of our schools, you can't have cell phones, right? So if this is the resource that the kids want to use and they're having that craving and they need to text, a lot of the school counselors are really good about letting kids have a break and come in, to the counseling center and use that resource. So it's really great.
Good to know. You can also have youth complete a substance use evaluation to determine if substance use treatment can be helpful. In Lincoln, substance use treatment services for youth are kind of limited right now. Youth can seek treatment or therapy at an outpatient level. The Bryan Independent Center does offer short-term residential treatment for ages 16 to 18, so even age is limited as well. So oftentimes what we'll do is they may need a higher level of care, so we might see them in our outpatient clinic 2 or 3 times a week to kind of supplement that. There are programs I don't know if in this, I think Omaha, Nova is a program that will take youth. However, sometimes transportation or financial resources aren't there as well, so that makes it more difficult. At one point, there was an adolescent intensive outpatient group. We had a residential for female youth. Funding is usually the issue there. And you would think Lincoln's not that small that we would have more resources. We just don't at this point. Therapy and medication management services are available to youth struggling with mental health and substance use concerns at various agencies and private providers in the community. A good resource is psychologytoday.com to search for therapists, psychiatrists, treatment centers, and support groups in the area. It won't give you everybody. A lot of times, I will just Google, I'll say, okay, psychiatrists in Lincoln, med management providers, different keywords. SAMHSA.gov also can help you find treatment centers near you. You don't always have to go in Nebraska. I've had people go outside of the state. Also, sometimes there's a financial concern there. Sometimes they give scholarships to people because they really do want to help. teen-safe.org/resources is another great resource. And actually, I'll click on it here really quick. Kind of pull it up. It goes directly to several different resources for parents, for kids as well, and youth. This is a really great resource to access different treatment providers or information about how to get help. Any other resources that you're aware of?
I was just going to say, a lot of our schools are a great starting point, depending. I mean, they can only help with so much because if the service isn't available, in the community, that makes it challenging. But, our school social workers, school counselors are great about helping families connect to those providers as well. And even, you know, I know some of our substance use providers are a great resource just to bounce questions off of. I know Bryan Independent Center has a case manager that parents can call just to get guidance and say, this is what we're struggling with. Especially because I think one of the barriers we see with our teenagers, or that I hear, is refusal of the kids to participate, right? It's very challenging sometimes, and that's frustrating for parents.
They don't take it seriously.
Yeah.
You could throw some of the even most, I don't know, eye-opening facts or dangerous information, especially about like fentanyl, because that's a huge issue right now. And they just kind of look at you with a blank stare and like, that'll never happen to me. So yeah, schools, a lot of times I think you can get a lot of the resources there as well. But like you said, they may be limited sometimes. Let's see. That's it. Any questions?
Can you just talk a little bit about, you know, as a provider, if you're seeing somebody, a teenager, for example, who's struggling with that mental health and using those substances as a means to cope, what does that look like during, you know, for families that aren't used to therapy or maybe haven't navigated that? How do you work through some of that and developing those coping skills, and what might that look like for a family?
So typically what we'll do is develop a treatment plan, and there's different modalities as far as like coping skills go, and different things that we can teach them and go over with them. So we'll do a lot of that. We'll identify maybe what their triggers are. You know, why do you use these substances? How can we, you know, build upon your resources in your life and in the community to help you stay sober or reduce harm? You know, what else could we get you involved in? I even talked to, I have a teen right now who's struggling with vaping, marijuana and nicotine. And I said, hey, maybe this is like a hand-mouth situation. What if we get you maybe some suckers or lollipops to use instead? So is there an alternative? So we talk about different alternatives that they can use instead of substances. Having parents, you know, be involved as well. Sometimes we will see some backlash if parents are too overly involved, searching their rooms all the time, or kind of other issues related to that. And so kids will, even if you take away their vape, they're going to get another one. And it's a continual type of situation. So we try to work with parents and guardians to come up with a plan of, you know, how can we deal with some of these behaviors so that we don't have a lot of this pushback and them going to their friends and getting other vapes and things like that. So a lot of it is teaching different coping skills. Let's engage you in different activities. What's available in the community after school, because that's a lot of the problem after school if parents are at work. You know, what resources are available? How can we keep you busy so that you're not thinking about using substances? Maybe we need to change some of the activities that you engage in, because you often associate that with using drugs, alcohol, vaping, those kinds of things. So
I can imagine a challenge for some of our teenagers. You know, I just think, especially if their peers are using, changing those peer groups are probably really hard. Is that something you talk through with that, you know, understanding that?
It's difficult, and even with adults,
it
is. Some of them, they do get to a point like, hey, I'm going to start going to, you know, AA, NA meetings. They find sober people to associate with, and they start to realize, okay, I need to change my peer group, because every time I go back to them, I start using substances again. With kids, it's a lot harder because they have this group of people, like, these are my friends, and we try to explain to them, okay, but if you're using substances with them and they're only hanging out with you because they're using drugs, I mean, are they really your friends? And so sometimes we can get them to a point where, like, yeah, maybe you're right. Maybe I do need to change my friend group. So maybe we can get you involved in some clubs at school or sports, you know, other areas where you may see less substance use, less vaping, those kinds of things.
Thank you. Does anybody have other questions? Sadie, do you have any other resources or anything that you would add that you're seeing?
Yeah, I wrote the youth are getting products from locations in town.
Mm-hmm.
If you visit the FDA website, they have, hello. If you visit the FDA website, they have a way that you, as a parent, as a person in the community, whatever, if you know that a youth is getting products that they shouldn't be because they're not old enough to, you can report that to the FDA and it will be investigated.
Okay.
The FDA does do local checks here. So if you put in a complaint about that, then they will do that. And I can give that to our folks at SCIP as well, so that
Okay.
they can put that out with the notes and stuff when they have
Okay.
that. So if that is something that's happening, absolutely, please report that to the FDA. We get calls all the time too. I work for the Lancaster County Health Department, so you can certainly contact us. We have the Tobacco Free Lancaster County Coalition. So if it's something that, if this is a topic that you're really excited about and want to be involved in what we're doing in the community, you can certainly join our coalition. And we're doing all kinds of things throughout the community to help battle back against this. There is also a text line for parents, and Abby has that information as well, that you can text in. It's through Truth Initiative, but it's a parent, or I would say any person that works with youth or is around youth, and would be available to talk to them about vaping, about anything to do with addiction and things. How do you support that youth in that? And it just sends you tips, and it's completely free.
Yeah.
So of how to talk to them, or advice or resources and that kind of thing. So
Great.
And Sadie did bring some of those little cards. Is that what you're referring to?
Yep.
Yeah.
Yep.
So we set them out on the table. They may not have been there when you first walked in, but check those out if you want to get those resources.
Yeah, I didn't even know some of that was available, so that's great. That's great to know. Yeah. Any other questions? Yeah.
So as you are working with your clients and helping to support them and find support for them, do you is there an area that you consistently come up as a barrier to making the suggestion, but that not being available in our community
Yeah.
or accessible to, the younger age group?
A lot of times it's the after school period where we find is a barrier. Unless they're involved in like sports or clubs, there isn't a lot of, from what I know, a lot of after school types of activities that they can be involved in, other than like going to the lighthouse or something like that. A lot of kids, tell them about that, but I don't really want to do that. I'd rather be at home, doing this or that or whatever. So that's one of the biggest barriers I think I find, is that after school time when parents are at work, or you've got a lot of single parents, and so they may not be as involved as they could potentially be. So kids have a lot of free time. So that's one of the issues that we find is pretty difficult, because then they associate with some of their old peers or the same peers over and over, and they lie to their parents and say like, oh, I was doing my homework, or we were working together at the library, which really wasn't happening. I'd say that's probably the main one that I come across.
If you hadn't caught our previous presentations, they are on our website. But we had our very first one, drug recognition expert officer Andre O'Connor talked a lot about some of the vapes with THC, what those products look like, more of the content. So if you just wanted a little bit more as well, go back to those videos. The second one, we had a pulmonologist come and talk about what they're seeing with the lungs and the heart. And so there are some other resources available. And so we do always record these. And so, this one was, we really wanted to kind of focus on that mental health piece, but just know that those are out there, and just knowing and understanding what those products look like and the ease that they get them. Snapchat is a big one where kids are getting those products from. Instagram, social media, and so being aware of the ease of that as well. Just looks different than it did years ago. So anyways, Andre in that first one talked about some of the Snapchat, some of the social media dialogue and language that kids use that can better help us as adults and parents identify what they're even talking about or referring to, because it's hard to keep up with all of that. So, anything else? Yeah. And I think one of the challenges we see, I am not a mental health provider, but we work with agencies to try to connect families. The wait list and the lack, I mean, there is not enough providers to meet the need in our community. And so that is really frustrating for families and parents if we have a young person who needs help now and you find out it's going to be 8 weeks before you can get support. That's really challenging. You know, another resource that we didn't really talk about is if they can't get into therapy, peer support. It's been kind of a new and up and coming, and I don't know, Terry, you might be able to talk a little bit more about some of the well-being initiative and some of the other peer support specialists that they're individuals with lived experience, right, who have come to the other side of their journey, whether, they're in recovery from addiction or they're in maintenance with their mental health. But that can be another good resource that's untapped for some of our kids. RAP is another one that's often facilitated. I'm going to let Terry just talk. Do you mind talking about, I know, because they're housed in your facility.
So we have the Mental Health Association of Nebraska as one of our building partners. I'm with Region 5 Systems, so preventionist, and they have they are peer support specialists, and I believe anybody can make a referral to them. And what's different about that versus another kind of referral, maybe a little bit to what you're talking about, is kids, you have to have a parent permission. Like, they won't do it on the down low. A parent needs to know that they're going to get in touch, but they'll reach back. Like, once you refer them, the peer support specialist will reach back. So it's a hot referral in terms of they'll get in touch and say, hey, I'm so-and-so from the Mental Health Association of Nebraska. And it's just conversation. It's not treatment. It's just, I have lived experience also. And so what are you doing to take care of yourself? And I know that because my cube is right there. So I get to listen to them do their thing all day long. The Wellbeing Initiative is also peer support specialists. So we have a lot of peer support in town. And then they also are kind of the anchors for RAP, so Wellness Recovery Action Planning, which is building a plan while you're well so that when you're not well, you have sort of a plan of action for how to deal with stressors, how to deal with, if it's beyond stress, what do you do in a crisis? Like, who do you want to call? Who do you not want to call? And that's offered free of charge in a couple of different places in town. So it's not treatment. And if somebody really, really needs treatment, it's not going to be a good stand-in, but it is really good just care. Everybody should have a RAP plan. Like, there's not a single person that wouldn't benefit from that. So those are good pieces. And you and I should talk, because I work with Faith Partners, so we can hook you. I have a manual. It's not a magic list, but I have a list that we've put together, so you don't have to suffer by yourself. I get that that's a frustration, but at minimum, you can put some gatekeepers in place that might be able to help. You don't feel so isolated. That's really hard. So.
Another one too. So the Mental Health Association, not only do they kind of call back and follow up, but they help them to navigate through services. And so they'll help them like, okay, what's going on? And then they can help to narrow down, these are the resources that would be helpful to you. So they do that. The other one I would recommend is PAVE, which is Parents Against Vaping E-Cigarettes. And they have a very, very, very active Facebook group. And so people can go on there and talk as parents of youth that vape, parents of youth that used to vape, parents of youth that they want to prevent from vaping, and they talk to each other about what's working, what's not working, what resources are helping them in their area, and that kind of stuff. So it's basically a support group for parents as well, because it is a difficult process to go through, and it takes a long time. And a lot of times in that prevention effort, it's coming from the parents to kind of educate themselves in order to have those discussions with the youth, and that's a lot to ask of parents to do as well. So
we feel you. We're here.
I forgot to add too, youth can also attend Alcoholics Anonymous and Narcotics Anonymous meetings as well. They have some young people's meetings where it might be youth and younger adults that they can connect with as well. A lot of them will kind of take some youth under their wing and kind of show them, like, this is what we do, this is how we get together and help each other. So that's also a resource. I think the Independence Center takes them to some meetings. When St. Monica's actually used to have an adolescent girls program, and I worked there at one point. We would take them to meetings as well, and it seemed to be pretty beneficial if they take it seriously.
Right. Yeah, and the other, just in hearing you talk about frustration of families and parents, not being serious enough yet. The unfortunate piece, and Lindsay can talk on this as the provider that does the diagnosing, is for treatment to be covered under insurance, you have to meet certain criteria. I mean, I see this all the time, like within schools, like we're seeing all of these things unravel. Kids aren't doing well. We think they probably would benefit from a level of treatment. They get into the evaluation and aren't quite to that level. Can you speak a little bit on understanding that? Because that is frustrating.
Well, especially like when it comes to nicotine, there isn't really a treatment that insurance will authorize for kids. Maybe on an outpatient level, we can work on that, but
That's where the mental health piece can come in.
Right.
Yeah.
So that's why we recommend a substance use evaluation. To get into any sort of treatment program, they have to have one. There's certain criteria that we have to follow depending on like how much they use, how often, those kinds of things that place them in a level of care. And there are several different levels of care. We just don't have all of them in the city of Lincoln or even in Nebraska necessarily. So we do see kids, I would say primarily at an outpatient level, but we can adjust that. It doesn't have to be just once a week. We can see them twice a week, 3 times a week if we need to. We can see them over Zoom if they can't make it in, because that's a challenge too, is being able to make it to their appointments. They forget often, and so we're constantly on them. We have the capability to text them about their appointments now, like, hey, just reminding you that you have an appointment. Oh crap, I forgot. Can we meet over Zoom? Yep, that's great. So that's been helpful with COVID, being able to do that. I hope they keep that, because that was the other thing, was insurance providers were saying, yeah, we don't want to cover that anymore. But a lot of research is coming out saying that it's just as effective as meeting in person.
Thank you, Lindsay.
Thank
so
you.
much for sharing your knowledge.
Thank you.